Welcome back to the Morning Blend. Summer's here, but persistent facial redness may have nothing to do with the heat or sun. It could actually be rosacea. Board-certified dermatologist Dr. Doris joins us to talk about this condition that affects more than 16 million people in the United States. Good morning to you, doctor.
Good morning. Thanks for having me, Molly.
Absolutely. So let's say someone's working with their doctor and they're trying to figure out what is the reason for ongoing facial redness. How do you know if it's more than just the result of summer heat and maybe some extra sun, and that it could be something more?
Well, as a dermatologist, what we ask our patients is a series of questions. We look for triggers, things like, have you been out having a few extra drinks with your friends in the evening? Or have you been under increased stress? Have you been exposed to extremes in temperature, like going from the heat to the cold? Or even with diet, more spicy foods or a change in diet to foods you're not used to can all be triggers for a very common condition that affects, as you mentioned, up to 16 million people, called rosacea. So those are the triggers. And what we see in rosacea are things like redness and a breakout that can look like acne, even a gritty feeling of the eyes can all be signs of rosacea. So as dermatologists, we work through in our minds what's a differential diagnosis of what all the possibilities are, and oftentimes it does come down to rosacea. And what throws people off is that they often didn't have rosacea before. It's something you kind of grow into in your late 20s, early 30s and up, and that catches people off guard. But once we review the triggers, what the signs and symptoms are in the skin, and that redness over time can become persistent facial redness, and that can have a really big impact on how on someone's appearance. And patients generally don't like that persistent redness. But in the past, we were limited in what we could do for it in terms of prescription medications. So I'm excited to have treatment options to offer my patients. And that's a reason to see your doctor, because over time, we do get medications that are added into our treatment options, and it is nice to know what your options are.
Yeah, absolutely, especially for people who've maybe noticed it and it's been going on for many, many years or months. What are the best treatment options, in your opinion, for rosacea?
So one I'm really excited about for that persistent facial redness is called Rhofade. And Rhofade helps tighten those superficial blood vessels in the skin that are making your skin look redder over time. And in their 29-day trial, and 2 trials actually, what they found was at the end of that 29 days, there was a 2-point reduction in that redness when you used it daily. So this is something you apply daily. In my office, I notice my patients tell me that it starts to work at about an hour, it peaks at about 4 to 6, and it wears off at about 12 hours. So they apply it daily, they notice a reduction in that persistent redness. My female patients tell me they often can go without makeup again, which makes them feel good to know that makeup is an option, not a necessity. And my male patients tell me that they love that their skin tone is back closer to normal or even back to normal.
When you say a 2-point difference, is that on a scale?
That 2-point difference means that in a clinical trial, you have to measure a certain amount of difference in order to reach that FDA standard to get FDA approval, and they require a 2-point difference. So there's a validated scale that they use to measure, and that 2-point difference is significant.
Where can people find out more about that medication?
You can go to rhofade.com, which is RHOFADE.com, or you can go to my website, which is myclearskin.com.
And you don't need a prescription?
You do. You need a prescription. So you have to see your dermatologist. This is an FDA-approved drug. It's a prescription drug, which is kind of nice because it often means it's covered by insurance. And also it has very rigorous testing to get that FDA approval.
Wonderful. Thanks for chatting with us. We appreciate it.
Thanks for having me.